Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the Language of Medicine 12th edition by Davy Allen Chabner. You are still here at week 2, but we have moved on to chapter 4, which is all about prefixes. Our chapter goals are to define basic prefixes used in the medical language, analyze word terms that combine prefixes with other word elements, and we're going to learn about the Rh condition as an example of antigen-antibody reaction. So let's get started with our combining forms. Remember, our combining forms are a root plus a combining vowel. So that's what our combining forms are. Carpo, cisso, costo, cutaneo, dactylo, ducto, flexo, glosso, glyco, immuno, morpho, morto, nati. Ooh, we've got a combining vowel that's an I. Oh, watch out for that. Make sure you memorize that. Normo, oxo, pubo, sepso, somno, sono, theo, and then you have, watch out for theo, because theo is different than philo and thelio. Tenso, thyro, topo, toxo, tracheo, urethro. Now on to some suffixes. Crin, drome, fusion, gia, lapse, lysis, meter, mission, or oxia. More suffixes. Partum, phoria, physis, plasia, plasm, nia. Watch out again for that PN. Tum, like symptom. Ptosis, rhea, stasis, trophy. All right, some prefixes. An means no, not without. Ab is away from, ad is toward. So if you extend your arm out away from your body, that's ab. That's away. Think of the B as facing away from the A. So if you're thinking ab, that B is facing away from the A. If you're thinking ad, like you're moving your arm towards your body, look at the A and the D. The D is facing the A. It's toward the A, not away from. And that may help you memorize those two. Anna, anti. And watch anti versus anti. You've got anta, anti. Anta is before, forward. Anti is against. So anta, anti. Otto, by, Brady, Kata, con. Contra, dia, dis, ec, endo. Epi, ex, hemi, hyper, hypo. In can mean not, into, or within, so watch out for that, because in can mean into or within versus not. Infra, inter, intra, macro. Mal, meta, micro, neo, pan, para. Pair and peri are a little bit different, so watch out for that. Poly, post, pre, pro. Pros, re, retro, sub, supra, syn, and sim. Tachy, trans, ultra, uni. Quick quiz. Which term means a muscle that draws a limb toward the body? Toward. So a muscle that draws a limb toward the body. Which term means painful painful breathing. Painful breathing. Breathing. Look for that part first. If you can find breathing, then it'll become obvious which is painful versus not breathing at all. All right, so let's talk about antigens and antibodies in the Rh condition. An antigen is a substance that's usually foreign to the body that stimulates the production of antibodies. So you can think of an antigen as an invader. It's coming in and it's going to draw a response from the body. The body's response are the antibodies. These are protein substances made by white blood cells in response to the presence of foreign antigens. So you have these antigen invaders that hit the body, and the body reacts by producing these antibodies to go fight those antigens. So now keep that in mind when you're talking about Rh condition. Rh condition is an antigen-antibody condition that develops when there's a difference in Rh blood factor between that of the pregnant mother when she's Rh negative only. If the mom's Rh positive, you don't have any concerns. But if the mom is Rh negative, and that of the fetus could be Rh positive, that's when you're going to have this Rh condition, antigen-antibody reaction. So let's see here. The first pregnancy, you've got a negative mom, positive baby. When the baby's delivered, you have to give the Rh factor or Rh immunoglobulin, because when the baby's born, you get all of these green Ys, which are the antibody that the mom's made in response to the positive baby, because she's negative, baby's positive, and when she delivers the baby, her body reacts by creating these antibodies. If she doesn't get RhoGAM, which is an Rh immunoglobulin, then when she has a second pregnancy, the antigens that were there from the first baby attack the second and can cause significant damage. So that's why if you have an Rh negative mom and you possibly could have an Rh positive baby, they typically want to give you RhoGAM so that when you have the second baby's not attacked by those antibodies from the mom. All right, quick quiz. Antibodies are made by what type of cells? Are they made by red blood cells, clotting cells? Hopefully that helps you. All right, congenital anomalies are an irregularity in a structure or organ that an infant is born with. Emphasis for congenital is born with. So anytime you see congenital, that means someone's been born with it. Anomaly just means an irregularity. So some examples are webbed fingers or toes called syndactyly, heart defects, and clubbed feet. Cleft lip or cleft palate would be another congenital anomaly. Some are hereditary, others are produced by factors present during the pregnancy. For example, fetal alcohol syndrome, where a pregnant woman drinks high levels of alcohol, can result in physical and mental defects in the infant at birth. Recombinant DNA. This is taking a gene from one organism and inserting it into the DNA of another organism. These techniques are used to manufacture insulin outside of the body. CRISPR is an acronym for a technique that is used to change DNA sequences and turn off genes or replace them with new versions. Syndrome. A syndrome is a group of signs or symptoms that commonly occur together and indicate a particular disease or abnormal condition. An example of a syndrome is Rye syndrome. This is characterized by vomiting, swelling of the brain, increased intracranial pressure, hypoglycemia, and dysfunction of the liver. This is known to occur in children after a viral infection that has been treated with aspirin. And this is why they always say never give aspirin to children, because if they're getting over a viral infection, treating them with aspirin can cause Rye syndrome. So that's why they always say acetaminophen or ibuprofen, but never aspirin. Transurethral resection of the prostate gland is called a TURP procedure, a TURP. And that's a portion where a portion of the prostate gland is removed with an instrument that's passed through the urethra. And it's often done because someone or a male has had their prostatic tissue grow, which is hyperplasia, and it's interfering with urination. And I think there's a figure in your book for this where it shows you how the prostate gland is around the urethra, and when the tissue increases, when that hyperplasia happens, it squeezes that urethra and causes difficulty urinating for men. So what they go in and do is they go in and they remove the prostate tissue that is squeezing the urethra to free that back up. And that's called a TURP procedure, or transurethral resection of the prostate gland. Next thing is ultrasonography. This is a diagnostic technique that utilizes ultrasound waves to produce an image or photograph of an organ or tissue. There are different kinds of these. You might have heard of a fetal sonogram or an echocardiogram, where they use ultrasound to map out the heart and if there's damage in the heart. So that this just gives you that information so that you can see. And your book has more on this. And that is it for chapter 4. Take care and have a wonderful week.